My name is Shashi Irukulla. I'm a consultant upper GI and bariatric surgeon at Ashford and St. Peters, my NHS hospital, and I'm also a deputy medical director. My private work, it ranges between different hospitals in Surrey, Berkshire, and Hampshire. So I work at Spire, Circle, Health Group, and other hospitals. I think it's probably a influence of my parents. My father is a pathologist, and also looking at other doctors in the family and friends, how they work and they talk about the medicine. That kind of inspired me to pursue medicine. And also when I did a work experience before becoming a doctor, I love the fact that you could do something to the patients and help them. So that, to me, is the most important aspect of healthcare. I have considered other specialties before considering surgery, and the time this was, I'm talking about, when I was in medical school, I looked at ophthalmology. Again, that's a surgical specialty, and medicine, intensive care. But the satisfaction I would get from being a surgeon is completely different to the other specialties, because it's a technically oriented, and skills are different to being a physician or radiologist, and the treatment is pretty instantaneous in most of the cases. Patients come with a problem and you do the operation, and next day they're completely different. Unfortunately, it may not be applicable to all pathologies, but majority of the times, I think a surgeon would be able to make a difference, whether it's a general surgeon, cardiothoracic, liver surgeon, or anyone. I think the surgery, to me, is more appealing in that terms. When the patient comes back to my clinic to say, I've changed their life, that is most rewarding, because I can see, especially weight loss operations or any operations where the patient has been suffering, and I offer them an operation, and then they come back to the clinic completely transformed, and that's amazing. I have been fortunate to have very good patients and understanding. I think the key is to have built that partnership with the patients, and I strongly believe in that, shared information and shared decision-making process. And all my patients, most of them, would say I am professional and informative, and I'm there to support them through their journey. Collaborative work is the mantra with the patients. I think you need to work with the patients to deliver what they require, not what I want them to have. Okay, that's why I think patient-centered care is mantra.